Linvoseltamab is a human BCMA CD3 bispecific antibody which is approved for the treatment of patients with triple-class exposed relapsed refractory myeloma who have received at least 3 prior lines of therapy in EU. In the phase 1/2 study in patients with relapsed refractory myeloma, linvoseltamab demonstrated high efficacy and generally manageable safety with an overall response rate of 71%. Infections were reported in 75% of patients. Linvoseltamab, in combination with several established anti-cancer therapies, is under evaluation in the multi-cohort phase 1 LINKER-MM2 trial. We decided to investigate the combination of linvoseltamab with anti-CD38 monoclonal antibodies such as daratumumab or isatuximab in order to evaluate the tolerability and response rate and progression-free survival of this combination. They are addressing different targets that are expressed on multiple myeloma. We know BCMA and anti-CD38 are both expressed on multiple myeloma, and we thought that with this dual targeting, we may enhance the response rate seen by linvoseltamab alone. There are data, recent data, as you know, to indicate that the combination of an anti-BCMA bispecific monoclonal antibody with an anti-CD38 monoclonal antibody may have enhanced activity and are worthy, of course, of evaluation in earlier lines of therapy. So the ideal patient population would be patients who have received 1 to 3 prior lines of therapy and who are not exposed or sensitive to anti-CD38 monoclonal antibodies. We included patients who have been exposed at least to 3 classes of agents, and the inclusion criteria were also evaluated, and we had the possibility to include prior daratumumab or isatuximab treatment if previously tolerated and if they had more than 6 months or 3 months of washout respectively since last exposure. We have included 42 patients so far. 1/3 of the patients were 75 years of older, 21% with triple refractory, and these were the main characteristics of the patients. We are still evaluating the response, duration and response, and PFS. I can give you some data regarding the overall response rate, which is 87%, including 53% of complete response. And with a median follow-up of about a year, at 12 months, we have 74% of patients who remain free of progression. Furthermore, among patients who are evaluable for minimal residual disease evaluation, all of them have achieved MRD negativity. So we are encouraged by this data. Of course, as I said, we want to have a longer follow-up to evaluate more in more details the progression-free survival and duration of response, as well the depth of response, because we have several patients who continue to improve their response rate.